Bring in Dr. Luke Evans.
Thank you very much, Chair. And I've got a set of questions leading on from that about communication. And first of all, to start, if it's okay with Dr. Byrne, you're a clinician as am I. So I'd be grateful. What would you say to a patient sat in front of you to explain what's going on?
I think the first thing I do is listen to what their understanding was currently and any concerns that they might be having, just to frame that conversation so I knew where we were starting from. I think I'd want to go through what the purpose and the ambitions of the programme were, which I do support. I think, you know, as we've heard this morning.
Well, so give me, because there's many people in the public, give me your spiel of what you would say. So I'm sat in front of you, Doc, I don't know about this data thing. What should I do? Should I opt in or should I opt out? What would you say? What's the answer to that question?
I would say NHS Digital, and I should add that perhaps NHS Digital would speak to this better than myself, as I'm not myself responsible for the programme. But I would say that NHS Digital are trying to improve the centralisation and collection of data to improve health research and system planning. And there are ways that they're doing that improve the current technology that's done with, which is now getting outdated and needs replacement. And if they are interested in finding out more, then I would encourage them to do so, including if they have any concerns to be aware of the choices they have about opting out for data use as well, because I think that's very key to hold that choice hand in hand with what the programme's doing at the same time.
That's really helpful, Dr. Byrne. Thank you. And that leads me on to the next stage of my question, which is to Simon Madden, if that's okay. Right. We're going for a DGP. I'm a GP by trade. I know that it's got SNODMED of joining it all together. We're either talking about probably EMIS or System 1. So the next question with that is what data are you guys collecting on that basis? Are we talking about anonymised blood pressures, diagnoses, age-related demographics, and that's it bulked off? Are we talking about something more about the treatment plan all the way through, so you can say, well, no, you know, Mr. Smith, although now anonymised, has got this whole longevity of his AF into his blood pressure problem, into his stroke, and his medication line he's on. Can you package that up for me? Tell me what that looks like. To Simon.
Thank you, and Chair Simon Bolton may want to come in on this as the technical expert, but I will do my best. So my understanding is that NHS Digital in the collection will collect data on diagnoses, symptoms, observations, test results, medications, allergies, immunisations, referrals and appointments. But crucially, what it won't collect is the entire GP record. It won't collect the patient name and address. It won't collect the written notes of any interactions between patients and clinicians, the so-called free text notes. It won't collect images, letters, or videos or documents. And it won't collect medicines, appointments, or referral data that are over 10 years old. And it won't collect legally restricted data such as IVF treatment or issues relating to gender reassignment. So I hope that is technically correct. But
really helpful. Simon Bolton, do you want to come in and answer if there's anything missed or that, or want to add any flesh to that bone?
No, so I think Simon Madden has got that right. The thing I would add, Dr. Evans, is around informed consent. So to your first question, we believe absolutely in informed consent. So what we need to do is present the facts and allow people to take their own decision. So it should be based on that rather than any recommendation from an individual.
That's really helpful because from my perspective, lots of doctors do presentations to other colleagues about a patient who's 25 who has had this operation to other doctors. It's pseudo-anonymised, but we can understand so we can learn, and that's how medical journals go on. Am I correct in thinking this is in essence what you are trying to do, but on a national basis?
Yeah, I think that's a good description of it.
That's really helpful. Thank you very much. And that leads me on to Lord Bethell. We've heard in the first discussion all about the pros and cons, and this is a passionate subject. Is it simply the fact that this is a good project, but the government's got the communication wrong?
No, I don't think that. I think it's very difficult. I think personal data is extremely sensitive in all walks of life, finance, retail, the internet. We're all having to come to terms with how our data is treated. And health is special data, it's particularly personal. So of course it has to be treated with that much, with additional reverence. I do think we may have made a mistake about thinking it as an IT project rather than as something that really has to be engaging with GPs and the public. And we're not really set up to do that within the NHS. So we're having to create infrastructure and technique to do that. But we're up for doing that, and that's what we're focused on delivering at the moment.
Well, that's really helpful because you're right, data is so important with all the discussions around social media, collection of data. What goes on in America in particular is often cited as a concern. Does that mean that the government's having a rethink about how to communicate this strategy due to the sensitivities and making that distinction of why the NHS is so different, both in the protection of the data, the understanding of that, and because of the place it has in our hearts around the concern about privatisation versus nationalisation?
I think we were always cognizant of the sensitivity of the data. And in fact, if you spend time with NHSD and X, they are like incredibly protective of the data, and we have the security and protocols and the legals all around the data. Now, I don't think there's any misunderstanding of how sensitive the data is. Where I think we have to be more ambitious is in the scale of the engagement. It's going to be a big project. Simon Madden ran through, I thought, a very useful 4-point plan that has dialogue at the center of the engagement. So I think Luke's idea of, what's your pitch to someone that's a helpful question to get the articulation, but that's not how we'll win this argument. We'll win by listening to people and then answering their questions. And doing that on a large scale, as we've done with the vaccine, is something that requires a big investment.
That's really helpful. Final question for you. What surprised you the most about this project?
Well, to be honest, I've now become a massive evangelist for it. It is the beneficial impact, both in terms of planning and clinical research. I really do think it can be transformational. I'm kind of staggered we're not doing it already. And I have massively prioritized it in my own focus, because beginning to come out of the pandemic and having thinking about what I've got to do in the year ahead, because I do think that the benefits for saving lives, for making the NHS more efficient, for advancing science are so profound.
Thank you, Chair.
Thank you very much.